Suicide is a significant public health concern. In Namibia, the World Health Organization reported that in 2012, the country had one of the highest suicide rates in the world and the fourth highest in Africa. And Dr. Katia Batista, a specialist psychiatrist, I would like to share recent suicide statistics in Namibia. In the annual suicide rate between April 2020 and March 2023, Namibia recorded 1,542 suicides, averaging over one suicide per day. Approximately 82% of these cases involve men. In the 2023-2024 financial year, 542 suicides were reported, with 449 men, 80 women, and 13 individuals under 18. This represents a 19% increase compared to the previous year. Cases of attempted suicide rose from 1,655 in 2018 to 2,332 in 2023, marking a 53% increase over 5 years. If I talk about regional distribution, the Oceania region recorded the highest suicide rate at 29.9 per 100,000 inhabitants, followed by Omusati 25.5, Onanguena 18.3, Comasenerongo both at 17.9 and Omaheke 17.4. Key studies of suicidal behavior in Namibia include Adolescent Suicidal Behavior Study in 2023. The overview of this study was a cross-sectional study involving 3,152 school-going adolescents aged from 12 to 17 years. The findings were 20.2% reported suicidal ideation, 25.2% had made suicide plans, 24.5% attempted suicide in the past 12 months, 14.6% reported a one-time attempt, while 9.9% had multiple attempts. Physical attacks, bullying, loneliness, parental intrusion of privacy, and cannabis use were significantly linked to increased suicidal behavior. Suicidal behavior encompasses a range of actions from suicidal thoughts to planning and attempts. It's essential to recognize warning signs, which may include talking about wanting to die or feeling hopeless, withdrawing from friends and activities, exhibiting extreme mood swings, giving away possessions. Early recognition can lead to timely intervention and support. Understanding the truth about suicide is essential for effective prevention and support. Let's address some prevalent myths and clarify the evidence. Myth 1. Talking about suicide increases the risk. The reality is that discussing suicide openly does not cause someone to become suicidal. In real life, it can provide relief and open the door for individuals to seek help. Engaging in honest conversation about suicide can reduce stigma and encourage people to access support services. Myth 2. People who talk about suicide are just seeking attention. The evidence is any mention of suicidal thoughts should be taken seriously. It's a sign that someone is experiencing significant distress and needs support. Dismissing these expressions as mere attention seeking can prevent individuals from receiving the help they need. Myth 3. Suicide only affects individuals with mental health conditions. The evidence is While mental health conditions are a risk factor indeed, suicide can affect anyone regardless of mental health status. Factors such as relationship issues, financial problems, trauma, or the other life stressors can also contribute to suicidal thoughts and behavior. Myth 4. Once someone decides to die by suicide, nothing can stop them. The evidence is suicidal crises are often temporary. With appropriate support and intervention, individuals can find alternative solutions to their problems and recover from suicidal thoughts. Timely help can save lives. Myth 5. People who attempt suicide will not try again. The evidence is that a previous suicide attempt is one of the strongest predictors of future attempts. It's crucial to provide ongoing support and monitoring to individuals who have attempted suicide as they remain a risk. Myth C. Suicide is a selfish act. The evidence is individuals who die by suicide often believe they are a weight to others and their death will alleviate pain for themselves and their loved ones. It's a manifestation of deep psychological pain, not selfishness. Myth 7. Only certain type of people have suicidal thoughts. The evidence: suicidal thoughts can affect anyone regardless of age, gender, socioeconomic status, or background. It's a universal issue that requires attention and compassion across all demographics. By debunking this myth, we can foster a more understanding and supportive environment for those struggling with suicidal thoughts. Encouraging open dialogue and education is key to prevention and saving life. So, if you know someone who is going through this, or you are the one going through this, there are professional interventions. Seek for help in the psychiatrist or psychologist. So there are some therapies that can help. Safety planning interventions is a collaborative approach between an individual and a mental health professional to develop a personalized plan to identify warning signs and coping strategies. Cognitive behavioral therapy for suicide prevention is a structured, time-limited therapy focusing on identifying and modifying negative thoughts, patterns, and behaviors associated with suicidal ideation. Dialectical behavioral therapy, particularly effective for individuals with chronic suicidal thoughts. This therapy combines individual therapy with through group skill trainings to enhance emotional regulation and interpersonal effectiveness. Then, what you can do? Everyone has a role to play in suicidal prevention. First of all, educate yourself. Learn about warning signs and risk factors associated with suicide. Be supportive. Listen without judgment. Encourage individuals to seek professional help. Promote open conversations. Reducing stigma around mental health can encourage more people to seek assistance. Advocate for resources. Support policies and programs that increase access to mental health services. Suicidal behavior is a complex issue, but with understanding, compassion, and appropriate interventions, we can make a difference. If you or someone you know is struggling, please reach out to available resources. Remember, you are not alone and help is available. Thank you for watching. If you find this video informative, please subscribe, like, share for more content of mental health and well-being. Thank you.